Program Well Body Talk, where they come to you live from the Society for Ready Democracy 98.1 FM. Well Body Talk na program where they come to you every Thursday from 5 to 6 o'clock, even 10. Inside the program Well Body Talk, we dey talk about different sickness, wetin dey cause am, treatment, signs and symptoms, and self-prevention. As we dey always get experts in the studio, we will talk about different sickness and inside this edition, with studio guests wey na Dr. Fosten James, obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. And inside today's edition of the program Well Body Talk, we dey talk about fertility challenges, myth, facts, and solution. And where they present this Well Body Talk program come to you this evening, my name na Karifa to Conte. Remember, say yourself where they listen and watch we live na Facebook. You go get chance for be part of the program by where you go send a comments or text message to the number 077981981 or self you go now we get the Democracy Facebook page. The program now Well Body Talk, they come to you live from the Society for Ready Democracy 98.1 FM. Well, inside the program, I get with me Dr. Fosten James, we na the obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. Good evening and welcome to the program Well Body Talk. Okay, welcome again. I see we don't can the first step. Okay, well, the program now Well Body Talk, it come to you live from the Society for Ready Democracy 98.1 FM. And inside this edition of the program, we dey look at fertility challenges, myth, fact, and solution. Well, Dr. James, don't start for look at generally within our fertility.
Okay, Fambude Unadu. So, me na Dr. Fosten James. Me na specialist gynecologist, obstetrician, University of Sierra Leone Teaching Hospital Complex and Cottage Hospital. So, infertility, the way man and woman we done it together for 1 year, then they get regular mommy and daddy business. We say regular, we mean frequently, at least 3 times per week, unprotected, and the woman will get belly. Then they make them infertile.
Okay. So now let's look at wetin the mean way man or woman are fertile.
Yes, so like I explained initially, if woman infertile, that means say not go able conceive, you not go able take in belly, you not go able get belly. If man infertile, that means say not go able make woman get belly. So then the woman would say man infertile and female infertile.
Okay, so when they talk about fertility, only gets for do with born.
Yes, so fertility basically it's around born business. We get other areas them way also they touch around that, like where you get belly, they lost the belly, but majorly fertility born business now they talk about.
Okay, so blood type gets any weight we get for do with born pikin when fertility.
So blood type of blood group now they affect fertility. What they affect is it make woman with a miscarry.
Okay.
So you get your own pathway they play.
So that means say if this gets type A or type C.
Yes, so we get what we call blood group incompatibility.
Okay.
That means a different blood group between you and the partner. In terms of the what we call resource type. If that one day no the match, you go get the belly, but the picking go get problem or the belly go get problem. You know they make you not get belly, but what you know more the belly will go get issue go arise during the pregnancy or if you don't born the picking.
Okay, so if una gets the two partner then gets the same type of blood group, or this guy on type blood group and this guy on type of blood group, then go able for born picking.
Yes, so if it's compatible,
how?
Particularly the resource type, so we go to call negative and positive.
Okay.
Okay, generally we go to then call blood group A, B, O. But what's important na the resource type, we na the positive and negative. You can then say blood group A positive, A negative, B positive, B negative.
Okay.
So if that is incompatible, like if the man na positive, then the mommy or the woman na negative, issue the day.
Okay.
But you not go make you not get belly. It go only affect the pregnancy, the belly. Where you don't get the belly, it go affect them. But you not go stop them from making you not get belly.
Okay, so many a times we don't hear you say we couple they way two partner they want for get married, they go hospital for know them blood type for see if them go able for born. So wetin are the different type the way person then go get way go make label for get speaking.
So like I say, the most important aspect of the blood group or the blood type where they check for if you are married and for know if you are two are positive or negative.
Okay.
So it no matter if the man are A, the woman are O, what's important now the positive and negative. If the like I say if the man are positive, then the woman are negative, now they the belly will get problem. But like at the end, those parameters in terms of the quality and the quantity will affect the man and ability for impregnate woman. So yes, the sperm nine are the major concern we talk about man fertility.
Okay, so what about some man where they produce plenty sperm but in sperm not able for give woman belly?
Yes, so when we talk about sperm, we talk like I said, we talk about the
Continue for the with me na the program and name na Dr. Fosten James and the obstetrician and gynecologist department of obs and gyne at the University of Salon Teaching Hospital Complex. As in there so today for talk about fertility challenges, myth, facts and solution. Remember say yourself where they listen and watch we live na Facebook. You go get chance for be part of the program by why you go send any comment or text message to the number 077981981 or self you go now get the Democracy Facebook page. And later on inside the program, we go for open phone line. Usai people go call the number 077981981. Ask question about the topic what they do it then at the program. When our fertility challenges, myth, facts and solution as we get the experts in our studio with we. So now let's look at plenty term people can say way you take computer, you put on a lap, it work, they affect you sperm counts.
yes, so there's really not direct relationship with where they put computer or laptop. Now you lap where they work and the quality of your sperm.
Okay.
So waiting basically they happen is that the computer or the laptop they generate heat. Okay, so that heat they affect the sperm production, the process of sperm production. So not to like say that the laptop where they put now the heat where they generate. So if we are in a situation where like there's no heat production by the laptop, or like the place is air conditioned and you know they actually get heat where they affect that sperm production, the computer not gonna make or laptop not gonna make his sperm quality poor. It is the heat that is produced from that laptop that actually affects the sperm production process or the quality of the sperm. So yes, so if you look at time in a way, it will affect, it will affect.
Okay.
But not to like saying that the laptop, we put laptop now, the foot there, it affects. No, it's the heat. Sometimes they produce like serious heat will go affect the sperm production or the quality of his sperm to me. So when they put the problem by the woman, everybody just takes it like that.
Okay, the program now will body talk. They come to you live from the Society for Ready Democracy 98.1 FM. You self can be part of the program by way go send a comment or text message to the number 077981981, 077981981 are the number for sending the comments or text message on the program. And later on we get for open phone line. Also people go call and ask question about the topic what they do with today. When fertility challenges, myth, fact and solution as we get the experts in the studio with we when Dr. Fosten James in the obstetrician and gynecologist Department of Obs and Gyne University of Salon Teaching Hospital Complex. So that could all look at some of the different things them we can cause infertility. So now let's look at what it can be the cause of infertility per man.
Okay, so like I say, number one, the sperm.
Okay.
We'll talk about sperm. We'll talk about abnormalities in the sperm. Anything where they make the sperm abnormal. The one thing where they make sperm abnormal are the quantity. Okay. Then we get the quality. I will talk about that initially. So for the quantity, anytime where man and woman they get that business, there's an amount of volume of sperm where the man for release for make woman get belly. If that quantity they not taking the man release, the woman will get belly. So for example, we were there in the field, we know the number, the figure. Where that figure they at least there's an amount of sperm quantity where in need for come out for let the woman get belly. But that sperm quantity wey dey comot, there is an amount of sperm cells dem wey for dey inside it, wey for make the woman get belly. So you go find out say sometimes the sperm go comot boku, but the actual sperm cells dem wey dey there wey for make woman get belly, dey no reach the optimal amount, like the number way for it for let woman get belly.
Okay.
So that is in terms of the quantity. Quality I don't talk about ability for let the sperm swim, for let move go before, for let they alive, for let get normal shape. So those are the things that affect male infertility. So that are just for the sperm. We also get what we call hormones. Hormones are chemical in our body, where they make the body function, how they function. So as woman and as man, the man get your hormones then, majorly testosterone. That one they also they play part for where the sperm produce. So if you don't get that for some reason, any reason you don't get that testosterone, that hormones there in the right amount, the sperm production will be affected, and as a result, the sperm count go low. Okay. Also, some people that's so them born them.
Okay.
Okay. There are people we get some things that we call undescended testes. So the man parts in testicle or in the balls. Sometimes they not form well.
So which means then type of people not able for born
Yes,
picking.
because part of what they produce the sperm now you testes.
Okay.
So if that did not form well or can't do say for day, it is say once one ball is empty, the other one so that one can one or two not in the sack. Okay. So if that they happen, they affect also sperm production. So basically anything that affects your sperm production. Some people they'll be done undergo operation. Okay. So when sperm they produce, it get passage, it gets away the pass for come out by the woman. So during the operation, if they operate you, then mistake tight, that would be that sperm. You will produce the sperm, but you know come out.
Okay.
To be inside there. So essentially you will get the intercourse, but they produce no sperm. Or you will make the woman get belly. Okay. So that's some of the things that they cause male infertility.
Okay, so now let's look at waiting at some of the things they get where they cause infertility per woman.
Yes, so the woman, your own partner, get more causes.
Yeah.
So for make we understand what the cause infertility per woman, we need to understand the parts that we by the woman.
Okay.
So one of the main important parts that we all know like the womb, inside the picking the ledom. We also know about the tubes. The tubes and outside the egg and the sperm, then the pass and outside they meet up.
Okay.
Okay. Then are the tubes. Then we get the ovary. The ovary now the thing that they produce the egg. Every month, every woman they release egg. That egg they up at the ovary they come out. Okay. So that thing I don't call the womb, the tube, and the ovary. If they want to get problem, anyone can get problem, it will affect the woman. It will make in one will be problem. Okay. So waiting are some of the things the way they affect the womb, we will make woman able to conceive. Okay. So if the woman get fibroids, okay, fibroids the way big or way they inside the womb, inside the pikin for go lay down, that they don't go occupy. It go difficult for the woman to get belly. Okay. Then for the tubes are the passage. We say the egg the pass, the sperm the pass for men meet up and fertilize. If round there they block, particularly for two block, no matter what you do, you know get belly because
okay.
The egg and the sperm they know they meet up.
Okay.
For let picking form, the egg and the sperm therefore meet and fertilization occur for let picking form. But if then tube they don't block, nothing no go make it get belly. That's the problem they solve. Then we go to call for the ovary, we go to call ovulation. Where I say every month, every woman for release egg, we for make with the sperm be fertilized and get the pregnancy. So if they release egg, they ovulate basically. Like
okay.
They ovulate or you get problem with your ovulation, it could be difficult for you to get belly. Because if egg not there, like the sperm count and the sperm come, you don't get nothing for fertilize. So the woman need for the ovulate every month. Okay? So that's some of the things and then some sickness the back woman they get.
Okay, so we can look at the secret way woman they get we go tap and for making able for born picking. So now you mentioned one thing that we mentioned, you say the tubes them if them block. So what can cause for let the tubes then can block per woman?
So now we setting or generally one of the commonest causes that for let woman in tubes and block
Okay.
na infection, also called PID, pelvic inflammatory disease. So if woman they get repeated or recurrent infection, all time they get infection, you go you treat yourself, you go to pharmacy, you buy medicine, you treat yourself. So if they reach a point, that infection they get, it ascend. We call and say ascend, they go up. Okay? And so it start at the vagina, go up, say go to the tube, go other parts there. So that one day whether infection they go to that part say by your body, and that tube they well. But they well and they form scar, what we call fibrosis. Okay. So now they happen frequently, they make the tube, they reach a point, they block. So
Okay.
you don't get what we call fibrosis or scarring inside it. So repeated infection per woman they lead to make it tubes and block.
Okay, so now let's look at again the difference in them with the different sickness where they cause infertility per woman.
Okay, so one of them we common what we call PCOS, polycystic ovarian syndrome. Now sick we also get for where they affect woman, we get for deal with hormones, other parts of my body. You can see the woman that we can get big body.
Okay.
Okay, like basically the body big and some even get beards in face, woman where they
Okay.
get chin and day, and even the hair distribution and body different. So if you see person again kind presentation and that kind of features as woman, then also they get problem with in menstruation. Sometimes they like every 3 months they mess, or after every 6 months they mess. You know they mess every month basically. And then also if you check in body for them chemical now being called, you see say the man hormone testosterone is high. But now woman but you get high levels of man hormone and testosterone. So if any woman will present to 19 and they get problem with in period, they get like features of way fever man, they get abnormality in chemical within in body, the hormones there, and the other person they get what we call PCOS. So that one they affect the born one because already they get problem with menstruation.
Okay.
And the menstruation and ovulation you get abnormal before you get belly. Okay. Another thing we can affect woman in born one when are sick, called endometriosis.
What's in Andy?
Endometriosis basically now we by the woman in womb we get different parts there. We get the inside of the womb, inside the bikini they don't. We call it endometrium. If that part stay for any reason like it shed off, it come out it go for the other side. That inside by the womb, it go the other side. It cause problem for the woman. It cause problem for the woman. Okay? For example, if that party come out inside the womb, they go find itself inside your belly, for example, or you go for one part the ovary, it cause problem. Okay? As it cause problem, it affects ovulation business, it affects even the egg in pass one for already kind of the tube. So any sick where they affect ovulation, they also affect the one. So endometriosis is one of them. PCOS is another one.
Okay.
Yes.
Okay, is it true that any woman we engage in sports self they get challenge for making be fertile?
Yes, so we not directly relate women in sport and infertility. So
Okay.
what
Because
happens,
you mentioned say woman we get beers,
yes,
big body and other one them.
yes. So but women the way they involve in sport not get behind.
But
Yes,
their
but-
body structure can
Yes,
also
so
feel
what
like
happens
man.
is
So.
that women them way they involve in sport, they do a lot of exercise.
Okay.
A lot of exercise on the extreme. Okay, so what happens is that when you do that, when you like you are doing a lot of exercise as a woman, it affects your menstruation, it affects your ovulation. Okay, take in cancer the incident period.
Okay.
Yes, the one that they run there long distance within serious sports, then they can need a mess. It's not because they're a man, but because of the exercise they're exposed to. Because of that exercise, they affect the hormones in your body. Okay? We get what we call the HPD, hypothalamus, pituitary and ovarian axis. So by exercise, they affect that part in your body. And when
Okay.
that part is affected, it affects the hormones that way for make you ovulate, that way for make you get belly. So we woman would into serious sport like that. They run a long distance or we don't the exercise for long. It can also they can get issue with bone business.
Okay.
Yeah.
So what about the man there?
So in fact, on the contrary, or the reverse, is that man the way involved in exercise, they produce a lot of testosterone,
Okay.
which is good for sperm production. So man for exercise is good. Okay, that don't mean woman not for exercise. We talk about extreme
Exercise.
yes.
Okay.
Yeah.
Okay, continue for with me at the program. A name now Dr. Fosten James, obstetrician and gynecologist, Department of Obs and Gyne at the University of Salon Teaching Hospital Complex. As in there, so today for talk about fertility challenge, myth, fact, and solution. The program now well body talk. They come to a live from the Society for Ready Democracy 98.1 FM, and where they bring this edition of the program well body talk. My name na Karifa to Conte. Remember, say yourself where they listen and watch we live na Facebook. You will get chance for be part of the program by way go send a comment or text message to the number 077929191 or self you go now get the Democracy Facebook page. Well, anytime from now we do open the phone line. Also, people go call the number 077929191, 077929191 at the number for call. Ask question about the topic what they deal with then at the program when fertility challenges. Myth, facts, and solution. So now, Doc, let's look at food. Get anything for do with fertility?
Yes. So food not the way go make you infertile.
Okay.
But food the way go help for improve your fertility. So if, for example, woman that can count bone problem or bone business to be. We get food them would advise them to take. However, we need to make them very clear. No particular food, no the way will make woman not born, but food then they will help you. Okay, for improve you, for increase your chance for let you able born.
Okay.
So generally, we get food them will contain certain elements or minerals them. Okay, we mark for patient then. So if we get food that we get the elements and the other minerals in there, you can take them. Like any food we get, like vitamin E, vitamin D, okay? Then folate, okay? Folic acid. Any food we get folate now. We get vitamin E, we get vitamin D. It's good for bone business. Sometimes they say for patient can come, we can just mark for them the tablets, vitamin E, vitamin D, folic acid. So food that we get down there and they like vegetables there. Some particular fruits then they where you take we get the one then go help you born business. But particular food no they we will say not take them, it will affect you born one.
Okay. So Doc, what about some woman they see in messes clearly every month, then it also can go hospital, they say not get a infection. So it can be the cause for let themselves be infertile.
Okay, so like I was saying earlier, parts that they by the woman. We're responsible for born one. So if you get your period normal, we assume say the ovulate normal. The other problem we could be is that sometimes the tube block. Like I be said, tubes they can block. Okay, so if you don't go, they don't check you not get infection. The period they can normal. They don't prove say they ovulate or that we agree we don't like be confirmed say they ovulate. The most other possible causes could be the other one, like sometimes the tube line block. Sometimes they get some fibroid where they affect you.
Okay.
Yes. Sometimes even the road we call a cervix. Sometimes the inside can block. It can be to cause cervical stenosis. The man with the sperm, the man they release, but the sperm no, they really actually go inside. All they come over. Okay. Or the quantity of go inside not they go because the cervix is stenosed. Okay. So other causes then if you don't talk say okay this woman ovulate or the same period, you not get infection. We need to look at the other causes then.
Okay. So age gets for do with infertility?
Oh yes, age is a very important aspect who can by this talk infertility. Okay. Both for men and women.
Yes.
If one of the myths them is that people if you say man not get age limit.
Yes.
Man they born
they say man they born. We say all in all
yes.
what is sticky the born.
Entirely true.
Okay.
Okay. I think one of the things they would not hold for long as true, which is really not true. Okay. So for age limit
for man,
what we know is that as you the age, as the man in age they go before, the sperm in quality they drop.
Okay.
Yes. When you dey so young, 30, 25, 28, and now man wey dey 45, 50, not to the same sperm quality.
Okay.
The man wey dey 45, 50, 60, okay, go give belle, but it might not be as fertile. Okay, it will take maybe longer time for like give belle than that man wey na 28 or 30 or 35. Okay, so essentially the age of the man they affect on sperm quality.
Okay.
And for the woman then, so for the woman then, and then we get a cutoff 35 years.
Okay.
Yes. So 35 now is that's cutoff. So before 35 years, the woman egg infertility most times it's very perfect.
Okay.
When you don't pass 35 or when you don't near 35 going above 35, your fertility potential drops. And you born picking one, basically the potential they begin go down.
Okay.
The chance for you get belly now pick when at 21 years old, not to the same. Okay, because as you the age as woman, egg in quality and quantity it dey go down. So if you not possibly they get belly every 2 years or every 3 years, the age that they drop. Okay, so age they affects fertility both for man them and woman them.
Okay, the program now Well Body Talk, they come to you live from the Society for Radio Democracy 98.1 FM. Remember, say yourself where they listen and watch we live on Facebook. You go be part of the program by why go send a text message or watch we live on Facebook. So the number 077981981 or Self Now Radio Democracy Facebook page. Well, inside the program now, we don't open phone line. Inside people go call the number 077981981, 077981981, and the number for call and be part of the program. So, Dr. James, now let's look out to get any remedy for this infertility per man and woman.
Yes, so
now let's start for look at the one for the man.
Okay, so for the man them.
Okay, we don't get to first call on the program. Good evening, your name and inside the call form.